hello to the people that are starting to come in. We'll just wait a little bit longer to get a few more people in, and then we'll start the session if that's okay. Steffi or Kiana, do you want to let me know when I should start? No, you're not early, as in you're perfectly on time to the question in the chat. Okay, I think we'll start, if that's okay with our panelists. And if people want to come in as and when, then that's absolutely fine. So welcome everyone. Thank you so much for being here. This is the first of our 4-part series brought to you by the Centre of Sustainable Healthcare, and it's running adjacent to the 26th United Nations Climate Change Conference, or COP. I'm very excited to have been asked to kick things off. So the plan today is I'll start by introducing myself, then I'll pass over to our 3 brilliant panelists to introduce themselves, and then I'll set the context for today's session, and we'll kick off with the main question. We are hoping to record this talk and have it available on the Centre for Sustainable Healthcare's website. So hopefully that's okay with everyone. Great. So just to introduce myself, I'm Simran, or Simi. My pronouns are she, her. I'm a final year medical student at the University of Southampton, and I'm currently on placement in Bournemouth. This is my hostel accommodation, as you can see. Also, just to say, Jessica is just there. She's popped in. She will be monitoring the chat. Yeah, I'll explain that in a second as well. So yeah, my background wise, I've interested in neuro, so I did my master's at King's last year. I also love getting involved in projects related to sustainable global health, socioeconomic health determinants, and education. And actually most recently, I was awarded for a piece I wrote at the Royal Society of Medicine on surgical sustainability. Hence why I'm buzzing to be here today, and I'm actually doing my elective with CSH next year. So really excited to do that. So our panelists, we've got 3 brilliant panelists, Doctors Abby Devainayagam, Dr. Richard Smith, and Ben Rusholme. If I could pass on to them to introduce themselves now. Anyone can start. Abby, do you want to start?
Sure, thanks, Simi. Hi, everyone. My name's Abby Devainayagam, and my pronouns are she, her. And I'm a medical doctor by background, and I'm training to specialise in public health in Liverpool. And my research and advocacy is at and around the intersection of climate, racism and health. So I'm the advocacy lead, and I'm a writer at Race and Health. Race and Health is a collective of academics, activists, artists and other people who are working to tackle the impact of racism and discrimination on health. And we wrote the upcoming Lancet series on racism and health, and I lead our theme of work on environment, environmental inequality. So please follow us at Race and Health, and you can check out our social media pages and resources. And we've got a quarterly newsletter on this topic. So that's a little bit about Race and Health. I also work on something I like to call abolitionist public health, which is about learning from abolitionists and what they can teach us about health, sustainability, and climate. One final thing just to mention very quickly in my introduction is, speaking of COP, there is an event that Race and Health are co-organising with a few other groups called the People's Health Hearing. It's a free event. It's taking place on Sunday, the 7th of November. It's in person and virtual, and essentially it's a space where people from all over the world will be sharing their stories through art or through a verbal testimony on how the root causes of extraction and extractivism harms people's health and how communities around the world are resisting. So if you can join, please do. It's going to be a place where we can feel really energized as people, as health professionals, beyond COP as well. So yes, that's how I look at the climate crisis, that it's birthed from forms of oppressions like colonialism, racism, and overconsumption in powerful economies. And I think often climate and health conversations are incomplete without social and racial justice in them. So yes, that's me.
Thank you very much, Abby. That event sounds great. And I can already tell this is going to be a great conversation. Can I pass on to Richard Smith now, if he could introduce himself?
Good, thanks, Simi. So I'm Richard Smith, and my pronouns are he, him, and I'm the chair of the UK Health Alliance on Climate Change, which I fear many of you will never have heard of, although I hope one day it'll become much more familiar. We're an alliance of pretty well all of the major medical and nursing colleges, the physicians, the GPs, the surgeons, the obstetricians, the pediatricians, and the BMA, and the BMJ, and the Lancet. And altogether, our members have 900,000 members. So it's a large proportion of the NHS workforce. And we come together to do everything we can to mitigate the effects of climate change, to promote the benefits to health, which are considerable, and we'll discuss more, and to encourage adaptation, because as I'm sure you all realize, climate change is not in the future, it's right here, right now, having big effects. And I've been writing about climate change since the mid-1990s, because what I'm actually best known for is I used to be the editor of the BMJ until 2004. Other things that are relevant, I'm the chair of the Lancet Commission on the Value of Death, which might sound a little strange, but I'll come back to that, because I think how we die is linked to this, as in a sense, everything is, like Abby says, racism, everything is linked to climate change. I'm also the chair of Patients Know Best, which was started by a medical student. It's a company where we suck together all the records of patients from general practice, different hospitals, mental health, social care, and put them under the control of the patient, which surprisingly is a tremendously radical thing to do. And we actually have contracts now to do that for about 12 million people in the NHS. And that is relevant too, as I'll explain when I talk a bit later. That's me. I'm glad to be here and good to join this conversation.
Glad to have you, Richard. Thank you so much. Dr. Ben Rusholme, would you like to introduce yourself?
Thanks, Simi. Yes, I'm Ben Rusholme. My pronouns are he, him, and I'm a GP, a newly qualified GP, actually. I finished my training in August here in Winchester, where I still live, and I work now down in Southampton on the South Coast. And I've been interested in doing some work on climate change and its impact on health for the last few years, which I started during my training. And increasingly, the work I'm doing at the moment is more on how we can advise people to cope with the changing climate. So, for example, how can you keep cool when there's a heat wave in a sustainable way? I lead in my practice on sustainable issues. I work in my local area with other GPs that are interested. And I also work with some GPs in a national group to try and have that larger systematic change that we need to tackle the climate crisis. So thanks for having me this evening.
Thank you very, very much again. Okay, so these are our three panelists. I'll just talk about the aims for today as well. So our aim is to have kind of really insightful and thought-provoking conversations with both our panelists and our participants. Jessica will be keeping an eye on the chat throughout. So please ask questions as and when they crop up. Crucially, this initiative is collaborative and it's student-led. And we are the generation that these discussions are going to impact the most. So it's critical that we're involved in suggesting and implementing solutions as much as possible and at every stage. So thank you for being here and do get involved. Okay, so today during the first session, it's known as the Inform session, we're aiming to kind of get a better appreciation of the interdependence between planetary and human health. Introducing firstly the role and responsibility of healthcare infrastructures and professionals, and touching a little bit on critical changes in healthcare training in the context of the climate crisis. So I'm going to now say the main question of our session, and then each of our panelists will have about 5 to 10 minutes to talk about it. Again, questions are open at any point and that should start the discussion. So our main question is, why does the planetary health crisis give reason to the way that healthcare professionals are trained?
Who's starting? Sorry, who would you like to start?
Anyone can start. Go on, Abby, go for it.
Go on.
Okay. I'll try. So the relationship between climate and health is always, if you put a status on it, it's complicated. And I think that essentially is the fact that it's not just bidirectional, and there are so many different ways in which they interact. And that is really important for us to realize before we, I think, start talking about how to change education. And I think often the relationships can be confused and conflated. And so I'll try and break it down a little bit. So the first side of it, I suppose, is climate is a powerful determinant of health. And for that, our response needs to be fast, because as Richard said, it's happening now, and we need to act now. We need hospitals ready to respond. We need borders open for climate migrants. We need our countries making plans for that. We need to hit the emergency brake on fossil fuels. So that's very acute and that's very responsive. And there are many ways in which the health impacts actually manifests, and it doesn't happen equally, as we know. We have socioeconomic, racial, gender, etc. inequalities in how air pollution affects our health, in which heat affects our health, in which disasters affect our health. And it affects people depending on their caste and religion and whether they live in prisons or not, and what their migratory status is, just to name a few. And this, of course, happens across the life course, from a Black baby in London exposed to air pollution being born with a low birth weight to an older adult in the Amazon dying early because of mercury contamination. So it's all connected and it's very complicated, but that's one side of it, the fact that the climate crisis determines health. And this is why we need to be ready to participate. Why does it give reason for the way we're trained? Because we're going to be on the front lines and this is going to be the mainstay of our work. In terms of the other side of it, okay, one other thing to mention actually is that all of this exacerbation of the climate crisis through these forms of oppression that I've talked to you about, racism, colonialism, different forms of oppression, is ultimately down to the C word, which is capitalism, which we need to talk about openly. The way that our economic system is formed currently continues to exacerbate, to do things the way that they are right now. So that's something that we as healthcare professionals need to connect the dots and advocate. And advocacy is something that we're not trained to do well, I don't think, in medical school or at all. I didn't really learn how to be an advocate, whether to be an advocate, to be apolitical or to be political, all of that, but we'll talk about that later. So that's the one side of the relationship. The second side of the relationship is, and I think this gets a lot more airtime in our circles, is sustainable healthcare, and the fact that our health system is a major contributor to environmental breakdown. And I'll say why that's in inverted commas. So the NHS net zero plan, which we've all heard about, is a huge step in the right direction. The NHS is responsible for 4% of the UK's carbon footprint. But what about the other 96%? So I think we need to think about that as well, and our responsibility as health professionals to tackle the other 96%, which is fossil fuel, energy, transport, businesses, waste management, etc. So that's the other side of it. I think that gets a lot of airtime. There's a lot of funding for that. So many funding calls for sustainable healthcare. Really important. So I think that's a very simplified version of the issue, and the fact that it is complicated. And I find that sustainability often lacks to include justice and like the environmental justice movement. And then the environmental justice movement is often put off by the sustainability movement. I don't know if you agree with this, but this is something that I've felt in the years that I've been involved in these spaces. And we need to, I think, come together in some way, because I feel like we tend to work in silos. So on one hand, we have health professionals trying to take down the fossil fuel industry through their work and lobbying. And then on the other end, we've got people doing sustainable inhalers and anesthetic gases. And I feel like we need to come together somehow. And that's another thing perhaps we could talk about later. And maybe the solution is the fact that we don't present sustainability as a social justice issue. And maybe if we look at sustainability as a social justice issue and see how these things overlap, and realize that these issues need different expertise and time and space to solve, then we can place our energies where our skills are best. So as a medical student, with your skills and your passion, are you in this side of the spectrum where you're, protesting for fossil fuel industry, tearing them down, or are you at the sustainable inhalers end, or are you somewhere in the middle? Are you doing both? So I think that's something that we can perhaps reflect on and essentially interrogate which bit you're working on and where your skills are best, because often they will just get lumped together. People just communicate about green things and climate change. So I've often been talking about urgent health impacts of climate change through the commercial determinants of health on one end, when actually they expect that people might be talking about sustainability. So I think that the complexity of it is a reason why we need to be trained adequately as well. And we need people to understand the complexity of it and choose where to place our energy. And ultimately, health as a lens is incredible. People understand that health is an important issue, and that is something that will speak to leaders. So I think when we do learn how to be good advocates, then using the health lens as a tool is something that we can do great things with. But before that, we need to actually improve the establishment that we work in, and that's our medical system.
Amazing. Thank you so much, Abby. You touched on some fantastic points there in terms of how multifaceted and bidirectional the influences are related to healthcare and planetary health, and actually looking both within the NHS and outside the NHS at sort of a smaller level, as well as looking at wider infrastructures like capitalism. And particularly, I've really loved your point on training medical students in advocacy so we can harness our expertise in those different areas for a multifaceted solution. Thank you so much. I think we have a question. I don't know if we should answer I think we should answer the questions as we go along, if that's okay, because this is in relation specifically to a point that you've made. Would that be okay?
Yeah, sure.
So, okay, so it's not a question, but so Riaz said, really good point on capitalism. Currently all about profits for shareholders. There is now a big movement in capitalism towards impact investing in so-called environmental, social, and governance investments, or ESG, i.e. investing in more sustainable and ethical companies. I was wondering what your thoughts are about that.
I think it's important to unlearn a lot of things, and perhaps the big movement in capitalism, so the way that you said it, the fact that capitalism is within that sentence shows that that isn't something new and something that will completely transform our current economic system. So there are other models like circular economy and donor economics and degrowth and things like that we could perhaps look to. And I think as health professionals, we need to know what these concepts are, because if we do think the climate crisis is a health crisis and capitalism is not compatible with the way that we're doing things, then we need to know what the alternatives are. So I think this is something that I don't really know about, but it says it's a movement within capitalism. So my gut is, I don't know if it's going to be radical enough in the change that we need, but I'm really keen to hear a little bit more about it. Yeah.
Brilliant, thank you very much. Lots of terms that I need to look up after this. Donut economy. Okay, thank you. Should we pass on to either Richard or Ben?
Before we pass on, there's another question from Anna, just asking if we could quickly clarify what we mean by sustainability versus environmental sustainability versus climate change before we carry on, so that we know that everyone's got the same understanding. Is that all right?
Yeah, absolutely. Thank you, Anna. Does someone on the panel want to take that?
Shall I have a go?
Yeah, go for it.
So, I mean, with sustainability, people often talk about the triple bottom line. So it's about financial sustainability, economic sustainability, social sustainability, and environmental sustainability. And all three are going to have to be preserved if we're going to keep going. So the environment, in other words, is one bit of sustainability. So shall I carry on and talk, or do you want to go, Ben? Or
that's fine, Richard. Why don't you carry on?
Right. Okay. So I thought I ought to begin with an apology, as you can look at me, you can see I'm pretty ancient. I'm actually 69. I was born in 1952, when the world was in a much, much better state than it is now, although there are all kinds of terrible problems. But in terms of carbon emissions, I don't know the exact figure, but it must be something like 85% of all the carbon emissions have been emitted since I was born. So, you know, I'm one of the people who screwed up the planet. And I've written a poem, which is an apology to my grandchildren for my role in it. I mean, I didn't quite intend to do that, but somehow I've been very much part of it. Maybe I'll just quickly say something on the capitalism issue as well, because I went to a very interesting debate between George Monbiot, who many of you will know, you know, an ardent environmentalist, arguing that really we had to end capitalism in order to have any chance to respond to the planetary crisis. And then there was Adair Turner, who's, you know, very involved in all sorts of issues around the world on climate change, arguing the opposite. And it was a very interesting debate. And I think and then there was a vote at the beginning and a vote at the end. It was a very well-informed debate run by Intelligence Squared. And the conclusion really was, well, maybe George Monbiot has a good argument that capitalism is certainly part of the problem, but we have so little time to start to respond to this problem, that sort of start dismantling the whole capitalist system and moving to something else. And I think trying to define the something else is very difficult as well. And people in the audience felt that John Monbiot didn't do that awfully well. So the ultimate conclusion was that although capitalism is certainly part of the problem, it's also probably part of the solution. And I have to say, there are many, many businesses that are way ahead of healthcare when it comes to decarbonisation. So I think it's, as Abby says, you know, these things are complicated and there are arguments on both sides. So to turn now to the question of why does the planetary health crisis give reason to how healthcare professionals are trained? Well, I think the simple answer is that everything is going to have to change. If we're going to get through this crisis, then everything has to change from top to bottom. And that includes our health systems, which I would argue are not sustainable anyway. Going back to this economic, social, environmental, I mean, it's clearly not sustainable environmentally. I don't think it's sustainable economically either, and also socially. I think we've gone down a very unfortunate route of constructing very elaborate, complex sickness systems when we'd have done much better to follow a different route. So I would argue there's going to have to be change anyway. And you know, the Lancet had a commission on medical education and said, really, it's not up to scratch. It's just, you know, when you think that many of you who are medical students now will still be practicing potentially in 2070, if there's anybody left, which there may well not be, then, you know, one thing we can be sure about, it's going to be enormously different from now in ways that we can only just begin to envisage. So you need to be trained to kind of constantly change. And I think there is also an argument, which a friend of mine advances, that the whole model of medical care is sort of fundamentally flawed, and so applying, you know, basic sciences to people's health problems is not really the way it works anymore, and that actually we'd be much better off to be changed in change management and perhaps advocacy, as Abby is arguing. So I wanted to, I mean, we at the UK Health Alliance coordinated, and I don't know whether any of you noticed this, 220 health journals around the world to publish the same editorial on the same day. And this was including, you know, the National Medical Journal of India, the East African Medical Journal, the Chinese Science Bulletin, the New England Journal of Medicine, nursing journals, pharmacy journals. And that was kind of unprecedented. That had never happened before. And I think it illustrated that I was surprised that so many journals were willing to do this, because they recognize that this is a really serious problem. And we argued two things in that editorial. One is that we have to do everything we can to stay below an increase in temperatures over pre-industrial levels of 1.5 degrees. We're at about 1.1, 1.2 at the moment. And our second argument, which relates to what Abby was saying about justice, is that we can only possibly succeed in that if high-income countries like Britain make much bigger cuts in our carbon consumption, and we transfer resources to low and middle income countries. So I've spent a lot of time working in Bangladesh, and you know, a third of that country is set to disappear. A lot of it is disappearing already. The Bay of Bengal is moving steadily north. It's already one of the most crowded countries on earth. And if they're not helped, then it's going to be kind of catastrophic. And the sad thing is, although we argue passionately for 1.5 degrees, the reality is that we're probably headed to 3 degrees or something beyond. And nobody really knows exactly what that world looks like. But we do know that there'll be many more extreme weather events. There'll be heat waves, which I think Ben's going to say something about, floods, fires, mudslides. There's going to be crop failures. That's happening already in lots of places. Shortages of food and water. Rising sea levels, with quite a lot of Britain and other countries disappearing, including perhaps a big chunk of London, and as a result, sort of mass migration and conflict. You know, and that is the world that we're headed to unless we can make some very dramatic changes very fast. And it seems to me that there's no way that healthcare could carry on like as it is now in such a world. And the things we need to do to stay below 1.5, I mean, I agree with Abby that you've got to think both about advocacy, But I think, we do have a responsibility as health professionals. It seems in some ways, you have a duty to fix what you can fix yourself, as well as advocating for others. And the health systems, as Abby was saying, I mean, if you put all the health systems in the world together, they would be the fifth biggest country emitting carbon emissions. It's 12% of the US emissions, which is massive. And it's about 4 to 5% here. 1 in 20 vehicles on the road is related to the NHS. So we really need to make most changes. And the particularly crazy thing is, if you look at the Lancet countdown on climate change and health, most health systems have rising carbon emissions. Well, there's clearly something crazy about that we should have rising emissions when it's the major threat to health in the world today. There's some tremendous disjunction there. So we will need, renewable energy, electric ambulances, retrofitted buildings, all that kind of stuff. But also, I think it's absolutely essential to realize that clinical pathways are going to have to change. We just can't go on in the way we are. And Frances Mortimer, who's the medical director of the Centre for Sustainable Healthcare, which is sponsoring this, I think she does a very good job of kind of summarising how clinical pathways need to be changed. But in the end, it's for each set of professionals to work it out for themselves. But one thing is clearly patient empowerment and self-care. That's the thing she started. And I think we need to shift the balance, the power relationship between patients and health professionals. And that's where Patients Know Best comes in. That's what we're about in a way, shifting the power, giving more power back to patients. Because if you have meningitis, then whether you live or die is determined by what the clinical team does. But if you have diabetes or heart failure or the chronic conditions that people have now, a lot of it, whether you like it or not, is ultimately down to what you and the people around you and your social networks do. It's not really down to clinicians. And then secondly, it's about promoting health and preventing disease, because clearly the best way to lower the carbon footprint of the health system is that people don't need to use it at all. And then thirdly, around lean delivery, delivering services where people need them, which relates again to digital care, and reducing low value activity. I think there's maybe a lot of low value activity goes on within the health system. And to use an example, I had an epiretinal membrane, which I must admit I never heard of until I had one. And I found that most of the other doctors I spoke to hadn't heard of it either, but a lot of them seem to have it. I hope it's not just an invention by ophthalmologists. But I went through a whole lot of processes, 3 operations to have this thing removed. But in retrospect, it just wasn't really justified. I think it's an example, and I use myself, of where probably we just didn't need to do that in the first place. And then lastly, low carbon alternatives when you do have to go for treatment. So 20% of the carbon footprint of the NHS is drugs. And we need to use drugs in very, very different ways. We've become a very kind of drug dependent society. So these things I would say are going to have to happen anyway. And just to link in my interest in death, I mean, something like 10% of healthcare costs are spent on the 1% of people who die that year. And a lot of that, I think there's a lot of evidence of over-treatment, excessive care, which increases suffering and is not a good use of resources. But the good news to end with is that almost all of the changes we need to make actually will be beneficial for the health of people. The challenge is to actually make them. Thanks.
Thank you so much, Richard. There were some really, really important stats in there. And I think the point that stood out most is sort of, given the trajectory of our current human resource consumption and past resource consumption, climate disasters and their health burden, it seems almost inevitable. So both like a dual strategy for both sort of pursuing those innovative adaptations to current clinical practice to make them more sustainable, but at the same time as kind of actioning preventative measures seems to be what you're suggesting. From thinking about clinical pathways, streamlining them, empowering patients to take charge, taking a look at low value practices. I think prophylaxis and cure at the same time sounds to be what you're suggesting. Also, would be great to see your poem that you wrote if you want to put it on the chat. But yeah, thank you very much. I do think we have a question.
Yeah, there was a question from Madeline, who asked, how can we prevent healthcare professionals from becoming complacent with individually sustainable action and thus ignoring the system level efforts for change?
Great question, Madeline. Does someone want to take that?
I feel I've said enough, but I could have a go.
No, go for it.
Well, I don't think everybody has to do everything, I suppose would be my answer. So I think, you can think about broader system. Some people can think about broader system change. Other people can think about, making changes within your own personal life, your own professional life, within your own institution. I mean, in the end, we have to do all of these things. And I mean, it is absolutely clear that we can't counter this problem just by making changes at an individual level or at a professional level. There has to be global political action, which is why COP26 is so important. And of course, the reality is that Britain is something like 1%, although we're, the biggest villains in a sense since we started the Industrial Revolution and exploited the empire in a way that Abby's explained. So we are villains, but nevertheless, we are now only 1% of global emissions. So even if we were to sort out everything in Britain, wouldn't make that much difference. I mean, in the end, that's why we were so keen to get the Chinese Science Bulletin and the National Medical Journal of India, and the American journals. We also had them in Brazil and in Australia. It's countries like that that are huge emitters that are going to really, if those people don't change, then nothing's going to change. So of course, there's got to be kind of global advocacy, but then we've also got to change ourselves. And I think it's certainly at the UK Health Alliance, we try to work on all these levels. But you do feel at the same time, I mean, how much is China going to listen to the UK Health Alliance? Probably not a great deal. Whereas when it comes to the NHS and, neurologists I'm speaking to next week, inevitably, we probably have a lot more influence.
Thank you. Thank you very much, Richard. I hope that answered your question, Madeline. I think Anna might still want clarification on sustainability versus environmental sustainability and climate change. I don't mind taking that. Hopefully it's okay. So essentially climate change is all the things that Richard mentioned in terms of sort of anthropogenic carbon emissions, intensive farming practices, temperature rising. That's climate change as influenced by human factors. And they're leading to changes in terms of sort of droughts, floods, increased wildfires, increased migration of people. And its sustainability are practices that we can implement currently to make resources available for future generations as well. So preservation of our external environment. And we're doing that because the environment influences health. I hope that's okay, Anna. I think we have another question.
Sorry, Simi, is it possible for me to just come in and is it the question about individualism or no? Is there another question?
There's a reflection from Anna here about saying that there's not much point having conversations when it's not relatable to our public or professional lives, and whether it's important as a healthcare professional, because it seems to be quite unrelated to academics instead.
Does anyone want to take that in terms of these conversations?
I'm happy for me to talk more about how I build climate change into my clinical practice and the conversations that I have with patients, which I think might help to address that question if I understood it.
Yes, please take it.
Yeah. Actually, one of the things I want to say first, just because I've been reflecting on what Abby said about that scale and where you place yourself on it, is that I'm not an activist. I've always been the person bringing optimism much more than anything to the table. But it certainly made me think about how we all need to come together from all across that spectrum. And I was also reflecting on what Richard was just saying. And I wanted to say that I'm not perfect. I do actually have lots of stuff. I'm just moving house at the moment, and I'm sure the other panelists won't be at all offended if I say they're not perfect either. We've all got carbon footprints, and please don't feel bad about that. Just find what the thing is that you care most about and start with that, because we all need to start doing something. So to link back to our question about how we train healthcare professionals then, I think Richard put it really nicely. We really need to get it in the curriculum and not just see it as an add-on or an extra module, but really infuse it throughout the whole curriculum, because it really is about providing really good, best standard care, really holistic care. And it really does link into everything that we do and everything I do in the practice every day. And we need to know about this because there's so many health benefits to tackling climate change too. Whether that's walking or cycling rather than driving, whether that's the food that we eat and having a more plant-based diet. These are things that are good for health, but also really good for the planet. And the same goes for reducing the drugs that we prescribe or finding alternatives, social prescribing. And I think it's also really important we embed the climate emergency into medical curriculums, so that as a clinician, we feel confident in responding to patients when they come in and they talk to us, because a lot of people are feeling quite anxious about climate change now. And I also want to feel confident in knowing when bringing that into the conversation is going to be motivating and help people to make those lifestyle changes. Because I think if people think that they're improving their health, but also helping the planet at the same time, that can be a really powerful thing. And I also think if we embed this into our training of healthcare professionals, it sends a really, really powerful message that this is a valid use of our clinical time. And just like, sort of advertising green prescribing and the things that we're doing at the surgery, it helps to make it normal. And there's been lots of student-led initiatives, haven't there? There's been the planetary health report cards recently. And I think it's these kind of initiatives that really drive this agenda forwards and help to build it into curriculums. By far the most important thing we can do as students or as healthcare professionals is to talk about the environment, to start these conversations. So maybe ask about the greenhouse gases in inhalers, or ask about anesthetic gases, or be curious and start those conversations, because that really does make a difference. Or next time you do a quality improvement project, choose to do one on some sort of environmental issue or on sustainability. Healthcare professionals are really trusted, aren't we? People listen. And so it's important we use our voice to speak out about the climate emergency, to help bring about that systematic change that's needed, whilst also sharing our imperfections and the things that we're trying to do differently. I might leave it there and then see if we've got any questions to respond to.
There's one quick question. If you could just describe what green prescribing is.
Yeah, of course. So an example might be, and I don't want to oversimplify complex diseases, but perhaps a lot of people with depression might benefit a lot more from joining a walking group and spending some time in green space than from taking an antidepressant tablet. Or maybe someone with a bit of cardiovascular disease might benefit a lot more from joining a running club than from taking a statin every day.
Thank you.
Thank you very much, Ben. I think that was a good answer. I think your point about kind of embedding this across the whole curriculum is so important, given the impact it's going to have on our day-to-day working lives and practices. And yeah, I think you mentioned the planetary health report card, which is a really interesting way of looking at how much curriculums already integrate teaching on sustainability into their curriculums. And you mentioned quality improvement projects. So something that I came across when I was doing my research for my piece was, if all of us, I mean, we get points and things for portfolios as students for doing audit cycles and things. So even having an audit on sort of one surgery in your hospital and how to streamline it to reduce sort of plastic waste or inhaled anesthetics or single-use products or hand washing kind of waste, I think is a really good way to get everyone involved. So thank you very much. So just looking at the chat, we've got a couple of points. So one is by Marty, who says, I would really like to see the NHS be more active in talking about the need for active transport. My local council, Southampton, was the one that's been cancelling new bike lanes. Any thoughts on that? I'd like to start off by saying yes, definitely. The NHS should be more active in talking about the need for green prescribing, and having these conversations now is a start, but they need to be implemented to action. So yeah.
I suppose I could add something. You know, I don't know whether people are aware, but you know, the NHS in England is moving to integrated care systems, and the idea is to sort of end these gaps between hospitals, community services, public health, social care. So, you know, in that context, it becomes much more logical to say, well, you know, we should be thinking about making it easier for people to cycle. And actually, we're in a forum now where we're talking, you know, we're working with the local authority, and we have this joint responsibility. So, I mean, I think these integrated care systems, they're all at different stages. Some are doing quite well, others are just struggling. But theoretically, that's the idea behind that we're not just about hospitals and surgery and drugs and general practice. We're recognizing the kind of the importance of the broader environment.
Thank you. Yes, sorry, Ben, were you going to say something?
I was just going to add to that kind of hope for the future and more joined up working. That my practice, we've done a few things. We've put in a bike rack for patients to use. We do some of our visits where we go out and cycle so that people can see in the community that we're out and we're cycling. But a step like bike lanes in our local area would feel like a big project or a step beyond our usual remit. So that kind of joined up thinking and taking that voice and sharing it with local councils, for example, could be really powerful. And so I think this move to integrated care systems and bringing everyone together could have a big impact in the future.
Definitely. Thank you very much. I was wondering if I could ask a question just to the whole panel. It's kind of two questions. So we've seen how COVID firstly has had a disproportionate impact on our most vulnerable and our most marginalized populations. Sort of it's exacerbated the existing inequalities and instability of our global health system, which does remain rooted in colonialism, which Abby touched upon. But at the same time, we've never had more radical change in the healthcare system as has been almost necessitated by COVID. So what kind of things can we learn about how quickly we can actually change healthcare practices by COVID from what we've seen happen in COVID? But also, how are we likely to see a climate crisis pan out in terms of ecologically mediated health disparities for our most vulnerable populations? Sorry, I've merged two questions there, but I felt like they go hand in hand, and anyone can take it if they'd like.
I can start, and then I'm sure others will chip in. Yes, absolutely. If the COVID emergency is anything to build from, or like give us an idea of what's to come next, I don't think it's climate crisis. It's going to be like climate apartheid, because we've seen what's happened with the vaccine situation. We've had global north countries hoarding vaccinations. I feel like that's something that we need to be prepared for, and we need to decide how to tackle that. So that's definitely something to keep our eye on, the fact that all of these things are unequal, and they're going to be unequal, and certain actions need to be more urgent than others. So that's one thing. I'm just trying to think about the first question. In terms of what does it tell us about the change that we can have? Yes, the health system has changed. We've built hospitals, etc. But something that has really made a huge difference is what communities have done, what small businesses have done, and what people on the ground have done. There's mutual aid groups. So there's all this informal stuff that has happened during the pandemic that I think again tells us that the system that we're operating in needs to change. And there are lots of ideas out there in terms of how these things can be changed. And sadly, we can't really look to big polluters, and I say that in inverted commas, like China and India, etc. Because even the way that we look at national responsibility is quite contentious, because there's a paper written by Jason Hickel for Lancet Planetary Health about quantifying national responsibility, but also that looks at how far you go beyond the planetary boundary in historical emissions. So actually the USA and all of the global north accounts for the highest amount of emissions, and then the global south, even India, even though it's considered one in the top 5, is actually a relatively small polluter historically. So that's just something to say there in terms of the way that we look at these things and who is actually responsible and how things should change. And again, who is left to pick up the pieces when it comes to vaccines not being access to billions of people, and who's hoarding the vaccines. So I think, again, inequalities is something that we can learn from. They ultimately, yes, they have been exacerbated, but the solutions that we have, I think, need to have that justice lens. Otherwise, we will make the same mistakes again. And whether that's through things like, I don't know if you've heard of something called the Climate Stabilization Fund, and that's a concept written by Keston Perry, who talks about how global finances need to flow when it comes to repairing for loss and damage that has been done, and future loss and damage that's going to be done. So that's something like new solutions that we can look at, not necessarily to do with the health system, but I do think that as health professionals, these are things that we need to be advocating for as well. And there's a lot of work now on what climate smart health systems look like, not only in global south countries, but even in the global north. So we need to have a plan for how our countries are going to respond in an acute way as well to disasters, which I don't think we have yet with the NHS. We do have flood planning and emergency planning that public health do, but hopefully with integrated care systems, we'll have more of that joined up work where the community public health people are working with healthcare professionals to talk together. So yeah, in summary, we have things happening outside of the systems that we know formally in communities that have happened during the pandemic, people helping each other, people helping their neighbours, but also looking to the future, more speaking between everyone related to health. So that's the council, NHS trusts, GPs, everyone sitting at the table, community safety, fire and rescue. We all need to talk about this together. And I work in a local council now, and we've come up with a group of registrars in the Northwest have come up with a a climate survey, a sustainability survey, to help registrars come up. It's based on a Friends of the Earth document, actually. So it's a toolkit that allows you to assess what your local authority has done. So what has your council done? Has it declared a climate emergency? Where is their fleet from? Is it electric? Do they have an affordable warmth program? Is that sustainable? What is the regulation for new homes being built? Are they ready for the winter? Are they efficient? Things like that. So we need to be working together is all I can say.
Brilliant. Thank you very much, Abby. I think we have a lovely question from Jennifer now, maybe to provide a little bit of hope going forward, because we've had so many scary stats. So Jennifer says, I'm currently an F2 on GP rotation in a relatively deprived area. A lot of patients seem very unaware of the importance of sustainability surrounding healthcare and their own health. I just wondered if Ben or anyone else has any advice on how to try and educate patients on the significance of sustainable healthcare during consultations. Thanks.
I think I'd say don't be afraid to bring it up when you see people, because a lot of people, it is on their mind, or it's something they're worried about, or it's something that they'd be interested to know more about, the carbon footprint of their medications, or how the air quality could be affecting their breathing, and because there's things that they can do about that that's going to make them feel more empowered about it. Often people don't like talking about climate change because they feel like it's out of their control. But I find when I tell people that they can bring their medicines packaging back in and recycle it, or that actually on the weather app on their phone, it tells them when the pollution is particularly bad, and that there's steps that they could take to avoid that, that's going to help with their lung problems. People find it really receptive. But they can be challenging conversations, and I sometimes worry about bringing it up and what patients might make of it. That worry that maybe they'll think that I care more about the planet than their health, for example. So it can be a challenging conversation sometimes, but I find that generally they're really rewarding ones, and the more you do it, the easier it becomes.
Thank you, Ben. I love that. And it goes hand in hand with what we were saying earlier about actually empowering patients to make those decisions. And actually, it made me think of a conversation I had with my friend about how one reusable cup isn't going to change the world. But if all of us as consumers move to wanting to use sustainable, renewable cups, big companies which don't necessarily care about them are going to see that that's consumer sentiment and switch to aligning themselves with what the people want. And I think that can be applied in healthcare as well, in terms of patient sentiment around how they can feel empowered to make a difference to our own health and wider health. So thank you very much, Ben.
Can I add to what Ben, because I agree, I think you shouldn't be scared to bring it up. It may be a little difficult, but I think Ben's right that most people, there are not many people left who are not aware of this, but I think people don't really know, what does it mean? What can I do? And I think and there are lots of things, very simple things that people can do. Very easy things rising up to much more difficult. And I think particularly a lot of children. I mean, there was this evidence that came out a few weeks ago about, tremendous numbers of children, understandably, are very anxious about this. I have a friend, and her 7-year-old son, got to the state he couldn't sleep at night because he was worried so much about climate change. And we had a debate about, what would be the best thing for her to try and respond. And I think the evidence is very strong that just doing something, making a difference. So actually that 7-year-old met with other 7-year-olds in his class, and they got together and they made banners and they marched to the local town hall saying, we want there to be change. We want you to respond to climate change. And I think there's lots of evidence that doing something, whether it's in your personal life, whether it's beginning to advocate, writing to MPs, joining protests, actually that's very kind of energizing and a lot better than kind of thinking, oh my goodness, this is just awful, and I'll just drink more and smoke more and hope it all goes away, because it won't go away.
Thank you, Richard. I think actually that, I don't know, Grace, you said something about how we might feel like we're too far gone, but how making small steps. I hope that Richard answered your concern a little bit, but feel free to put if they haven't. Jessica, I was wondering if there's any questions that we've missed. I'm sorry. Or any points or anything.
Sorry, my internet just froze as you said my name.
No
Could
worries.
you just repeat that?
I said, are there any questions or comments or things that we've missed in the chat that we should address before we start to wind up?
There was a question a while ago from Anyam, who asked about any comments on sustainability in mental health settings. I wonder if any of you had any opinions on that.
Good point, Anyam. So I think, sorry, no. No, Abby, go for it. Did you unmute? Yeah.
I was just thinking whether it's, I can't think of any examples of sustainable practices within mental health settings that I am aware of, but I thought, Ben, I don't know if you've got any. From a primary perspective.
I see a fair amount of mental health in primary care setting. And I guess it comes back to, I know that a quarter of my carbon footprint as a GP is in what I prescribe. And actually, there's good evidence that talking therapies are the most effective treatment for a lot of the mental health problems that I see. And so I try and push them and explain to people how the cognitive and the behavioral therapies can help them. Before I turn to prescribing antidepressants and other medicines. So that would be one example. I mentioned earlier about the importance of green spaces for people's mental health. And I know a few mental health trusts have started to invest more in the green spaces in the inpatient mental health settings by building gardens and planting trees and creating these outdoor spaces. Those are the things that come to mind. For me.
I would just add something. I mean, the Royal College of Psychiatrists has done a lot of work on this. I mean, they've had a report on mental health and the planetary crisis, which is full of lots of ideas, some of the things that Ben was discussing. And I think it is tended to be forgotten a bit, but I think it's very important that mental health isn't forgotten. And I went to a good seminar run by Imperial about, I think this phrase mental health, it feels to me like it's got a little bit out of control, And so, I mean, if you're feeling a bit gloomy about the state of the planet and thinking, my goodness, what on earth is that going to happen? That's an entirely normal way to feel. That's an appropriate way to feel. You could say that to feel the opposite, everything's wonderful and we're all charging ahead, is the wrong way to feel. And there was a psychologist there, so we have to be very careful about categorizing these things as mental health problems. And there was a young woman there who'd been to one of the seminars given by this psychologist and said, I felt it was such a relief that when I realized, because I kind of felt pretty gloomy about all of this, I didn't have a mental health problem. In many ways, I had an appropriate response to the circumstances in which I'm living. And I think, again, going back to what I was saying just now, I think taking some kind of action, doing something, no matter how small, is one of the best ways to respond. And I think, somehow finding yourself taking antidepressants because you're gloomy about the state of the planet is clearly completely the wrong way to go.
I think we need to start let's sum up a bit. So I was wondering if we could have a quick sum up from everyone about, to sum up in a few words, how you hope that we can challenge the climate crisis as healthcare professionals, but sort of how healthcare training can empower med students to do that. So a little hope for the future, if we can end on that, that would be awesome. Yeah, we think we have maybe 2 minutes per person. Thank you.
Is it okay if I start? Yeah. I guess that one of the messages I want to get across is that you really don't need to feel that you're an expert on this to get involved. I certainly am not. Just go for it, find whatever bothers you, whether that's single-use plastic, whether it's the inequality, whether it's looking really into the detail of carbon footprints, or maybe like me, you just really want to help people adapt to the changing climate, and get out there. You'll find like-minded people, start those conversations. You really don't need to be perfect, but I hope that you found this evening helpful in what we've talked through.
Shall I go next then? I mean, just to say, I mean, I think something we must never forget, if we lived in a decarbonized world, that would be a much healthier world. And that actually what's good for the planet is also good for us as individuals. And, you know, it's young people who are medical students now, junior doctors, who are going to be in the strongest position to shape this, and are going to be, and are the future, in a way that I'm a rather awful past. And I think it's very important, as has been illustrated already with lots of examples, the Planetary Health Report. But I mean, I have a friend, James Bevan, who you probably know in Southampton, who's incorporated things into the medical curriculum. So there are a lot of students who are being very active about this. And I think that is the best way to be, that say we need to not sit here asking people to do things for us. We need to get out and make changes. And again, repeating what Ben says, that there's many different ways you can do it. It can be very small things, or you can get involved in a more substantial way. But somehow bearing in mind that what is good for the planet is good for us as individuals, and we need to make these changes, and we'll end up in a much better place if we can make them.
Thank you, Richard.
I think overall, we need to look after one another, and we need to support one another as health professionals in our role as health professionals, but also as people who have a duty to our planet and people's health as well, and have those hats on and look after each other when we're trying to navigate how to fulfill those roles. And I personally don't really remember feeling encouraged or empowered to be an advocate as a health professional, as an early career health professional. And most of us are here today because we have that buzz, and we have people, like-minded people together. So, you know, hold on to that. Join a group, as Richard said. I think, again, joining a group is work. All work is work. But the difference in community organizing and movement building is that support and that empathy is there. Whereas, you know, if you work in the NHS or for the academy, then that support is not necessarily naturally there at the moment anyway. So you'll find that you'll form some amazing relationships outside of your formal workplace, and that community will support you. And the thing I want to really, if there's one thing that I could say to you today, and it's that when you're talking about sustainability, make sure it's inclusive, because there are people who are, as I say, working on the climate justice movement, who are incredibly put off by the sustainability movement because it fails to look at the spillover effects for other people and how sustainability is not necessarily inclusive. If an active travel policy or a green space policy is put forward, who is it excluding? Who is that green space excluding? There's a lot of evidence on that. So that's one thing that I think if everyone could take away from my point of view, that would be it. And the final thing is, final two things is if you're a student, we have an incredible camaraderie and students coming together to approach the medical school, to approach your trusts, your head of training programs, to incorporate sustainable quality improvement in your ARCP or have it as a learning outcome in your curriculum. These things are success stories that are there all across the UK in different universities, and it's because of students. So keep doing that, and you're already doing that because you're here. And finally, this event is called Beyond COP, so don't forget about this Beyond COP. I know we won't, but that's just something that I want to put out there. We're all doing this work all the time, and we were doing this work before COP. So keep up the momentum and have strength in numbers.
Thank you so much, Abby. As a final year student, I can definitely see that we have so much potential. And everyone who's here has already made, I don't know if this is your first step or several steps, but I think it's the right place to be to start doing this. So thank you very much. Just to say, our next session is on the 3rd of November. And that's that'll talk a little bit more about kind of what we can do. It's about unlearning climate and health narratives, and it's called Equip. So it's going to help sort of us and how we can equip us with the tools to tackle the issues that we've talked about today. So please do register for that on Eventbrite. Thank you to all the attendees who asked brilliant questions and engaged. Thank you for the panelists who really fantastic conversations, for giving up your time to be here and inspiring us all to do our bit. Thank you very much. There is a feedback form which Kiana has just put on the page, on the chat. We'd be really grateful if everyone could fill that in. As I said, the recording will be available on the website after that. So it would really help to gauge what everyone thought went well or what we could improve for the next session. Yeah, so I think that's it. Yes, Richard? You're muted.
Sorry, I was just waving bye-bye. That's all. I thought that was the end.
Yes, it is the end. Thank you very much.
Great. If everyone's happy, I'll end the meeting then.
Yes, I think so. Does anyone else have anything to say?
No. Thank you, everyone.
Bye.
Have a wonderful evening. Good luck with moving house, Ben.
Bye.
Thank you, Simi.
Welcome.